Hi, Dr. Siegfried here, leading expert in the bilateral nasal specific technique. The question tonight is, do you have facial pain? Because if you do have facial pain, you may need a bilateral nasal specific treatment, and I can help you with that. But the first thing you need to do, ask yourself, is it eye, ear, nose, throat, sinusitis, migraines? And then you have to ask yourself, how do you make sure that it's nothing more pathological than the bones of the head being locked up, which is the best indication for a bilateral nasal specific technique, which happens from either a concussion, a fall, or a blow to the head. So for example, you may have facial pain that causes TMJ pain, which means temporomandibular joint pain. You may have had a concussion. You may have an infected tooth. You may have an implant that's an implanted tooth that's infected. You may have neck problems. You want to make sure that if you have facial pain, that all of these things, all of these problems are not, well, they may or may not be causing the problem, the facial pain, but you want to have these areas evaluated. The best way to have them evaluated is obviously a physical examination, but also more particularly these days, you can do a CAT scan, you can do an MRI, you can do an X-ray, you can have an ear, nose, and throat specialist evaluate you, you can have a neurologist evaluate you. But in the end, if these bones of your head are locked up, you have to have the bones adjusted, and the nasal specific will help that. Now, well, it may help that. We have to see you first, of course. Now, how do these bones get locked up? You could have birth trauma, like, for example, recently a lady that's 42 years old had birth trauma from forceps delivery. She's got TMJ problems, she's got bite problems, she's got grinding her teeth problems, she's got sinus problems. All of these things which have been allergy problems, immune system problems, all of these things which have been plaguing her since infancy. She's also had some falls throughout her life, but the biggest thing was right out of the gate, so to speak, the bones of the head got locked up. So we have to make sure that it is indeed that problem, and the best way to evaluate it is, like I said, with a lot of these modern techniques when they're available. So if those are if those tests are done and all of the reports come back normal, then we know this is a problem that could be helped, that may be helped with the bilateral nasal specific technique. So I hope that this is helpful to you, because there's a lot of people walking around with facial pain. They don't know what to do for it. They're tired of taking drugs for it, and they're really, quite frankly, stymied. So if you'd like to check into this more, you could go to my website at nasalspecifics.com. We have videos, we have testimonials, we have information on there that could give you more insight into why you may be having facial pain. Thanks for watching.